Learning from the Lazarus effect. For years, Grace Silva had experienced odd episodes with her throat, bouts of swelling and radiating pain that seemed to resolve with antibiotics, but her doctors couldn't explain what was wrong. Finally, after a flare-up in the summer of 2010, Grace was referred to a specialist, an ear doctor who felt something amiss on the left side of her throat, a lump. The Silva family agreed that it was time to get Grace, then 54, to a thyroid specialist. Grace's daughter Melanie tracked down the name of one at Brigham and Women's Hospital, a 90-minute drive from Grace's brown clapboard split level near New Bedford, Mass. In September 2010, the specialist delivered the diagnosis: anaplastic thyroid cancer. It was bad, he warned her, and she would need surgery. Grace's other daughter, Carrie, was marrying in a few weeks. Can it wait? Grace asked. It could not. And whatever you do, the specialist said, please don't look it up on the internet. Medical texts describe the prognosis for anaplastic thyroid cancer as poor, but that hardly captures it. If every cancer has a personality, this one is notoriously aggressive. Its tendrils of tissue are so invasive that by the time of diagnosis, it is often too late to operate safely. Radiation or chemotherapy rarely buy much time, and even when all traces of the tumor are eliminated, it usually reappears. Anaplastic thyroid tumors are also known for their aberrant firmness, more akin to wood than flesh. As they bloom, the tumors can tighten like a noose, constricting the windpipe and giving their victims a sensation of perpetual drowning. This panicky air hunger can be mitigated with escalating doses of morphine, but it's a miserable, desperate end that, once witnessed, is not easily forgotten. The oncologist Grace was sent to, Dr. Jochen Lork of the nearby Dana-Farber Cancer Institute, had watched a patient die this way during medical school, and it filled him with such horror, such helplessness, that for years he felt sure he would never pursue a career in cancer treatment. Of course, nobody dreamed of saying these things to Grace at the time. A surgeon removed her tumor, and she was able to attend her daughter's wedding. She then withstood a long stretch of radiation, every weekday for more than a month, vomiting into a bag as her husband, Joe, did his best behind the wheel of their brown Chrysler. Her doctors knew they had to hit the cancer with everything they had. By the end of her treatment in December 2010, Grace, a once vivacious Portuguese woman with dark eyes and raven hair, had lost more than 30 pounds and could barely eat or talk. In March 2011, Joe drove Grace back to Dana-Farber. She had started to recover some of her strength, and the day had come to learn the results of her first follow-up scan. The news wasn't good. Less than 3 months since her last radiation treatment, the cancer had already spread to her lungs. The largest mass, on her right lung, was more than an inch in diameter. This is the way with anaplastic thyroid cancer. Lork sat with Grace and Joe in a cream-colored exam room, a red biohazard box nestled under one counter, and explained that all the standard treatments had been exhausted. He told them about an experimental trial for aggressive thyroid cancers that hadn't responded to standard treatments, and Grace agreed to enroll. The drug, everolimus, was used in transplant surgery to prevent rejection, and it had been approved for some use in cancer. Lork had seen indications that the drug could work in the thyroid, but he didn't have high hopes for the anaplastic cases. Its long track record had been too dismal. Partly we were motivated, Lork told me, by the fact that we didn't have anything else. In the days after starting the trial, Grace found herself standing in front of the mirror in her bedroom, taking in her diminished reflection, beseeching God to give her some kind of sign. If her time had come, she wanted to know, for the sake of her husband and 3 children. If I'm going to die, I need time to prepare, she recalled thinking at the time. Either way, she felt sure that God would hold her by her right hand, as in one of her most cherished lines from the book of Isaiah. 2 months later, in May, Joe drove Grace to Dana-Farber for her follow-up scan. Lying motionless as the CT scanner began its inquiries, she thought of Isaiah and prayed. If the everolimus had failed to slow the cancer's advance, it would be time to begin the work of getting her affairs in order. But the scan results, plain to even an untrained eye, were shocking. The largest mass had shrunk to half its previous size. Everywhere there were signs of retreat. Lorck said he had never seen such a rout. All 6 of the other anaplastic thyroid patients on the trial eventually died, but Grace's tumors shrank until they barely registered. Grace's case became the subject of intense scientific scrutiny. How could such a notoriously recalcitrant cancer simply collapse? Why had she alone responded so extremely? Nobody was claiming that she was cured. But by the end of 2011, Grace felt this much was sure: having asked for a sign, she had become a walking miracle. What happened to Grace is sometimes called by another biblical name, the Lazarus effect, after the story in which Jesus stands outside the tomb of Lazarus of Bethany and summons him back to life. Many veteran oncologists have seen cases like Grace's, and the stories of these unlikely recoveries, shared online or by word of mouth, have become a source of hope for patients. Yet for the field itself, the Lazarus effect has been a source of persistent frustration. In 2011, for example, the Food and Drug Administration withdrew its support for the treatment of breast cancer with Avastin, a drug with proven efficacy on tumors in other organs. Some breast cancer patients had experienced powerful responses, and owed their lives to the drug, but most patients weren't helped and were instead exposed to unnecessary side effects. With no way to predict the results, the drug was as good as useless. Today patients like Grace have come to be known as exceptional responders, and cancer researchers have finally begun to unravel the puzzles they pose. In a cancer, some of the body's cells develop genetic aberrations, growing and spreading uncontrollably, and there are myriad variations on this theme. While physicians recognize hundreds of types of the disease, genetic analyses suggest that the true number is far higher. The closer that scientists look at tumors, the more mutations they find, to the point where it may be impossible to count the types of cancer. Really, every patient suffers her own personal cancer, and when a drug is perfectly aligned to it, to the exact set of mutations driving the tumor, the result is an exceptional response. In such a case, if scientists could catalog the tumor's mutations, they would have a shot at reconstructing a play-by-play, how the conflagration began, how the drug smothered it, and, from this, gain insights that could help others.